In this episode, we're going to discuss graft count numbers. So when you're having a hair transplant, how do we calculate the number of grafts that you need? So stick around and we'll unpack that.
Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone and welcome to the Hair Loss Show. My name is Dr. Vikram Jayaprakash. Thanks again for watching. If you are suffering from hair loss and you've gone through the discussion of medical therapy and then you get to the point where you're considering having a hair transplant or a surgical option, one of the things that you're going to want to consider is the number of grafts that you need. And that's something that you really need to have a chat with your surgeon about, all right? Because it has implications across the board. It's, first and foremost, it's what is the look going to be? Secondly, what's the density going to, what sort of density you're going to achieve? And thirdly, and importantly, what the expense of the surgery is going to be, because most of us that do hair transplant surgery, the cost of the hair transplant is based on the number of grafts. So the question is, well, how do you calculate that? And like I said, and I cannot stress this enough, it really is important to get a one-on-one consultation with your surgeon, the person who's going to be operating on you, and therefore can make an informed decision on the number of grafts that you need. Right, so how do we calculate the number of grafts? There's really no easy formula, and a lot of it comes down to experience and also an understanding of the intricacies, both the physical area that you're going to cover and the artistry involved. So one of the first things that we look at is the area that we need to cover, all right? So what is the area on the scalp that we need to try and, what's the hairline that we need to redesign, and what is the surface area that we need to cover? Because obviously the larger the surface area, the more grafts that we're going to need. So that's important to understand the function there. The second thing that we need to look at is what is the hair density of the existing area, both the recipient area and the surrounding area as well. Because if we're transplanting into a specific area that's going to blend into another part of the scalp, we need to make sure that the density matches. There's no point in creating a certain density if the surrounding area has a much higher density, because the area that we've transplanted into is going to look sparse, and vice versa. If the rest of the hair has a lower density, then we shouldn't be packing too much density into the recipient area. So trying to match that, not numerically, but optically, so it has a seamless look. That's important. That's what we're trying to achieve. And again, it will be down to measuring that surface area and the variety of methods that may take place, and then from that being able to calculate what the number of grafts is going to be. The third thing to look at is the hair color difference, okay? The hair skin color contrast, all right? So for example, if you've got someone with very dark hair and very pale skin, and so there's a high color contrast, then in that individual, you are going to need to put more hair into the area, because if it's sparse, then it's more likely to be see-through, as opposed to someone who's got very little skin hair color differential. Then you could probably get away with less density. Now, case in point, an example with that would be someone with gray hair. If you've got someone with who's Caucasian with gray hair, so pale skin, white color hair, there's very little color differential, and therefore the number of grafts that you would need per unit area, per square centimeter, whatever, is going to be less than someone who with black hair on white skin. So all of these factors are things that we need to take into consideration. And generally what I do is I I always say to patients, look, I'm going to give you a range. It's going to be, and that's from experience, it's going to be somewhere in this range. And generally I'm pretty good, and I sort of hit the mark within that range. There are times when I've overshot the mark, when I've undershot, and I say, look, we need to have that conversation, and we'll have that conversation during the case so that you're aware of what is going on. In the scenario of where you're designing a frontal hairline, for example, well, where you draw the hairline is going to make a massive difference to the number of grafts. Every millimeter lower or higher is going to mean more or less grafts. So, on the day and when we design that hairline, that any sort of variation that there will be will affect the final graft number. All right. So, for those of you who are sort of expecting, right, well, it's going to be X number of grafts per centimeter, and this is how you calculate there. I'm afraid it's not that easy. It takes a little bit more thought and consideration, but the underlying point is that you really need to be assessed to get an accurate view. Things like, scenarios where you send in photographs, or services where you send in photographs and then they give you a quote. It's always very difficult because photographs, you can take 2 photographs 5 minutes apart, they look very different, and you can get a slightly skewed view. So I hope that answers your question. Thanks again for watching. Please remember to like